afternoon. Thank you for joining us today. I just want to take a moment to acknowledge we're speaking today from the territory of Treaty 6 and recognize this is land also of deep importance to the Métis people. I'm pleased to be joined today by many people living with diabetes as well as parents of children living with diabetes, all of whom rely on the Alberta government's insulin pump therapy program, a program that just 1 week ago, the UCP suddenly announced they plan to cancel, effective on August 1st. And as you'll hear today from Jason Rain, Lisa Hart, and Leslie Thompson, this has caused great stress and concern for Albertans like them. That's why we're all here today, to call on the UCP to immediately halt their plans to cancel the insulin pump therapy program and to commit that they won't make any further changes to this program without consulting with the Albertans who depend on it. Now, I recognize the importance of reviewing programs to see how we can make them better, to improve coverage and ensure that they're achieving good results. But those sorts of reviews, any proposed changes, should always involve consultation and collaboration with those who rely on those programs and will be most affected by any changes. That is particularly true when it involves crucial supports to protect and maintain their health, like an insulin pump. After the UCP's announcement last week, many of the thousands of Albertans who rely on this program reached out to me to share their fears and concerns about what their lives will be like if they can't afford to access this life-changing technology. An insulin pump is much more accurate than injections of insulin with a needle. It improves quality of life, and it offers more safety, security, comfort, and freedom. It seems pretty clear to me that the UCP did little work to engage the community on making changes to this program. They failed to provide any transition plan or any details on what new coverage would look like. And while the UCP is benefiting from high oil prices, yet here they are trying to save a few $1 million per year at the potential cost of thousands per pump user and putting these Albertans' lives at risk. The UCP have failed to recognize and consider the savings to the health system that the preventative benefits of an insulin pump offers. A visit to an emergency room can cost thousands. And thanks to the chaos the UCP have caused throughout our healthcare system, our ERs simply don't have the capacity for even further demand. Now, I'll leave it to these folks here who've joined me today to expand on the life-changing impacts of an insulin pump, as well as the anxiety and the uncertainty that this rushed plan from the UCP is causing them. Simply put, a 3-month window with no clear plan for the path forward is not only cruel, it is chaos. This is unfortunately, though, typical of this government, and a good reason why Albertans simply cannot trust the UCP with their health care. But I and all of my colleagues with Alberta's NDP have heard the diabetic community loud and clear. Now it's time for the UCP to listen. I hope they're watching and listening here today to these Albertans who've joined me. I would like to now turn things over to Jason to share his thoughts.
Thank you. Hello, my name is Jason Boehm, and I'm here with my son Connor, who's 6 years old and was diagnosed with type 1 diabetes at age 2. I'm not personally someone who seeks the spotlight, but my wife and I are committed to advocating for Connor and others in this situation. Also, once Connor heard a few days ago that he would be coming to the legislature to speak about type 1 diabetes support and his insulin pump, he packed his bag and asked all weekend why we weren't there yet. Connor got a pump through the insulin pump therapy program 3 years ago. It's an understatement to say how life-changing this was. We had so many issues trying to find a daycare where he could safely receive the care he needed. With concerns of liability, schools and daycares struggle to offer the supports for children who require injections or need their blood glucose tested multiple times a day. At the start of our journey, we were told that it was left to the comfort of the daycare staff if they could provide insulin injections or tests for blood sugar. You can imagine the concerns that you would have as a parent when you hear that your child's safety supports were optional. The measurement of insulin from a syringe is critically important, and being plus or minus even a quarter unit of insulin could be a matter of life or death. Pump provides exact measurements of insulin, down to 0.05 units of insulin, in some cases better. and allows for the suspension of insulin if he is in fact going low. An insulin pump, in its simplest terms, gives a diabetic a level of control over the medication that conventional syringes and pens cannot. It also completes complex calculations which take into account his carb to insulin factor, correction factor, insulin sensitivity factor, and allows for the user to simply enter the amount of carbs he's eating, and all of that complex math is taken care of in an instant. The fact that Connor has an insulin pump means he can safely go to school with minimal support and still be safe. And mom and dad can have a sense of comfort that he will stay in range and not require emergency care. For these reasons alone, I believe the pump program should be made more accessible rather than hidden behind paywalls like the UCP policy changes would reflect. I worry about what his childhood would be like with no longer having a pump. It might needlessly isolate him from his classmates and friends and restrict him from certain opportunities. Thinking about Connor going to grade 1 in the fall, school staff may not be able to provide the full care and attention he would need with multiple injections. My wife or I would likely have to leave a job or find a new one with more flexibility so we could give more attention and care for him during the day. To be frank, our family has planned on Connor having an insulin pump while at school, and his care plan reflects that as he moves into grade 1 in the fall. The UCP gave a few months' notice sleekly via press release that the pump program has been cancelled without any details on what the transition or replacement program will look like. This lack of details creates anxiety and hides a lack of planning by the government. I identify as a progressive conservative and do believe in responsible spending by the government and appreciate reasonable cost savings measures, but this isn't one. This may save a small amount of dollars at the outset and cost substantially more in the back end due to bad medical outcomes and additional hospital supports because of the reduced control if a pump is not available. And the stress that this put on families is immeasurable. This feels like an Americanized approach to diabetes management, where the patient is left to fend for themselves if they do not have enough money for medical care. Maybe there are aspects of the insulin pump therapy program that could be reasonably changed, and I am open to that conversation. But changes to the program must be done through a proper process that involves a diabetic community, which I don't believe has happened at all. With adequate lead time to allow to make informed decisions on next steps. 3 months' notice with a sneaky press conference just isn't enough. Thank you.
Thank you, Jason. Appreciate your thoughts. Happy now to hand things over to our next speaker, which is Lisa.
Hello. My name is Lisa Hart. I'm emotional already. Both my daughter and I have lived with type 1 diabetes for the last 17 years. Being able to get an insulin pump through the insulin pump therapy program for my daughter changed our family's life. The safety and higher quality of life that an insulin pump brings cannot be understated. 17 years ago, for us, insurance companies were unable to provide this cost. We were eventually able to get one for my daughter after lots of negotiating with my husband's private insurance company and going through a benevolence fund from his union. But we were told this is a one-time decision. Pumps are incredible, but they need to be replaced every 5 years. So after the warranty ran out, my daughter went back on multiple daily injections. However, shortly after that, the insulin pump therapy program was created, and she was able to get a new pump, which cost $5,000, and we were both able to get our supplies paid for through the program. I should mention that in the interim, I was able to get a pump for myself by taking out a personal loan. This was significant. There are so many out-of-pocket costs to taking care of diabetes. Canceling the insulin pump program will add many expenses to diabetics and their families. The cost for Blue Cross non-group coverage is not nominal, as Minister Copping has claimed. Many people living with type 1 diabetes and their parents already pay out of pocket for many other supplies, and the premiums and co-pays may be too much to bear. Putting the burden of what Minister Copping has said is a nominal fee amounts to an ableist tax on pump users in the province. The communication regarding this plan has been abysmal. The lack of details has caused panic and stress amongst the community. It has contributed to a further erosion of trust in the current government when we come to the realization that the UCP has yet again put the perception that they are saving dollars ahead of our health. The cost savings that Minister Copping has claimed are from a program that pays for itself in reduced short-term and long-term healthcare costs on an already overburdened system. The diabetic community feels unfairly picked on, ignored, and dismissed. However, living with type 1 diabetes or raising a child with type 1 diabetes gives us a strength that the UCP have underestimated. We will not go down quietly or without a fight. Thank you.
Thank you so much, Lisa. Lastly, I'd like to invite Leslie to share her thoughts.
Thank you, David. Hi, I'm Leslie Thompson, and I've been living with type 1 diabetes for 27 years. I got type 1 diabetes when I was 14 years old. Type 1 diabetes is an autoimmune disease, and living a life with it is a complicated and challenging life, but being on an insulin pump provides me with some freedom and a lot of control. The insulin pump allows me to have a flexible schedule, control my diabetes in real time, and most importantly, no longer having a fear of not waking up in the morning. The insulin pump has given me so much stability and control over my diabetes, I have been able to successfully run 3 full marathons to raise money for diabetes research. Losing the insulin pump therapy program means that I will have to go back to multiple daily injections, as you've heard from everybody else here as well. This causes less control of my diabetes due to the inability to afford this treatment. The Alberta government says that you can use your own health insurance, but in reality, most insurance plans do not cover an insulin pump and its supplies, costing me upwards of $700 a month without this program, not to mention the cost of an insulin pump. An insulin pump needs to be replaced every 5 years with a cost anywhere between $7,000 to $9,000 depending on the insulin pump you need. Multiple daily injections means I will be on multiple types of insulin, causing a roller coaster effect of my blood sugar levels. This roller coaster effect will cause multiple low blood sugar instances, which could eventually take my life, especially if it were to happen in the middle of the night and I were unable to wake up. It can also cause many high blood sugar levels, which leads to diabetes-related complications, which I'm sure we've all heard of. And these range from retinopathy to nerve damage, kidney damage, and even limb amputations. All of these side effects of diabetes will be a greater cost to the healthcare system and the individual with type 1 diabetes. This means more doctor's visits, more emergency room visits, and urgent care visits, further burdening the healthcare system that is overrun already. I am here today representing 4,000 people here in Alberta through the Protect Alberta's Insulin Pump Therapy Program group. Through our group, we have heard from hundreds affected with their disgust and outrage towards this cut. This cut will cause everyone financial hardship and having to make the decision to stay on a pump and go into debt or go back to multiple daily injections, causing a lower quality of life and putting one's life at harm. I'd like to share a story with you all from one of our group members who wrote into us. She tells us that an insulin pump therapy has been life-changing for her. Prior to starting on a pump, she was a brittle diabetic despite her intensive efforts to monitor and control her diabetes. Pump therapy has allowed her to adapt to the changing schedules and requirements in her daily life that affect her blood sugar control. With better control, she has less low and high blood sugar events that impact her ability to work and function as a business owner and a mother. Discontinuing the Alberta Pump program will impact her by increasing the cost for this essential medical therapy that she cannot live without. We thank her and everybody who has shared their stories with us and continues to reach out to us for our advocacy and to fight for this program to be brought back in. Type 1 diabetes is an invisible disease from the outside. Not once did I ever think that the Alberta government would try to make me invisible. Thank you.
Thank you so much, Leslie. Powerful words. As I said earlier, Alberta's NDP, we've been hearing the concerns of folks like Jason, Connor, Lisa, Leslie, loud and clear. So we're now calling on the UCP to do the same. Now is not the time to cause even more chaos in our healthcare system and in the lives of these Albertans who live with diabetes. The UCP must halt their plans and take the time to actually consult and communicate with Albertans who rely on insulin pumps. Thank you, and we're happy to take your questions.
We have a few reporters in the room, so we'll start with questions in the room, but if you are on the phone or the Zoom, please use the *9 or raise hand function. And, Carly?
I'm not sure who can answer this best, but I'm wondering if there's an estimation of what this change could cost for someone who doesn't have coverage, or even someone who does have coverage but doesn't cover an insulin pump. What will going on to Blue Cross mean? I don't know, maybe Leslie?
Anyone feel comfortable speaking to that?
Right now, we don't have all the information from the government of what the Alberta Blue Cross program will cover. However, what this will mean is a person having to pay another copay and insurance premium on top of insurance that they may already have to cover their insulin pump program. From what we've heard, it doesn't fully, the current program doesn't fully cover, not the current, but the program that they're putting in place doesn't fully cover what we currently have right now. But we would like more information from the government and from Alberta Blue Cross on what entails. Everything that we have found, it's not full coverage and it's going to cost out-of-pocket costs. What those costs are, we aren't sure at this time. However, if they are not covered and we are to use employer-backed insurance, a lot of employer-backed insurance does not cover it because they say the Alberta government covers it, so why do we need to cover it?
Let me speak to that briefly as well. I mean, this just goes to show how poorly thought through this transition is. I mean, either the minister did not actually sit down and calculate the cost for these Albertans, didn't actually do the work to figure out what the impact of his changes would be, or he's deliberately choosing not to share that information. Either way, that's just absolutely stunning on something that's going to affect the very lives and health of 4,000 Albertans.
Can I add something?
Yes, please, step to the mic, if you don't mind. Just so folks on the mic can hear you.
What we've seen so far is that for a family, at least it's $118 a month for the premium. And then the copays are 30% or up to $25 is the max. And that so far they haven't said if the pump themselves and the pump supplies are going to be covered under the $2,400 max cap for the year. For instance, for our daughter, her insulin pump is, I think, $6,400 a year for the Omnipod. So that wouldn't even scrape the surface. And the the insulin pump therapy program also covered test strips, lancets, remove wipes, skin tack wipes. There were so many other things that if they then have to go under this non-group coverage, it wouldn't even scrape the surface.
It's about, maybe, if you don't include the insulin pump, it's about 3 months worth of coverage just for supplies. That's not including the cost of the device.
Well, that was going to be my question about associated supplies, so.
It's a very comprehensive answer. Any other questions from the two of you in the room? And we'll make another pass for questions on the phone. If you have a question on the phone, please use the *9 function. Catherine, yeah, sure.
Yeah, I do have an off-topic question with the organ transplant bill that's coming up, and there's a an announcement on the continued program in hospitals to add specialized physicians. Will the NDP be supporting R.J. Sigurdsson's private members bill?
So certainly, yeah, we are supportive of initiatives, I think, to encourage more Albertans to be willing to act as donors. We recognize the incredible importance of that in the system, and certainly, yeah, we're looking forward to working with MLA Sigurdsson to make that bill as strong as possible so we can accomplish that. But what I would also note is we also strongly support taking preventative action to avoid folks having to go through that and having to require a transplant. And one of those things is an insulin pump. Right? Individuals who have challenges with diabetes, kidney transplants are not an uncommon thing, other organ failures. So certainly we support the government in efforts to increase the pool for transplant donors. But we would also encourage them to take real preventative action to prevent people from needing those transplants in the first place.
I guess maybe for you or whoever, how did you hear about the $25 maximum 30%? How was that communicated to you?
Well, so far, me personally, I haven't even received the letter from the government to say that this program is being canceled. Someone had posted on social media, and that's how we found out about it. And then a bunch of us started researching like what the non-group coverage was, because that was kind of the option for those of us that make a little bit more. So that's going to be another premium on top of the premiums we already pay. Because I know for me personally, it would not cover. Our insurance doesn't cover insulin pumps, so yeah. And did that answer?
I did get my letter. I got my letter, I got my letter on Friday, which was, I believe, 5 days after the press release from the UCP, and it does not state how much the co-pays will be. So it's still an unknown for us, exactly how much we'll end up spending.
And there's nothing in there about a low-income threshold? Or?
Probably. I'm not low income, but
The low-income
yes.
threshold is the standard low-income threshold
Okay.
for Alberta benefits. It doesn't change. The low-income people are apparently still covered.
And I mean, again, let's be clear on this. The Alberta Blue Cross program is a government program. There is no way that Minister Copping does not know how that program operates, what he intends to cover, and what the costs are going to be for these 4,000 Albertans. He is choosing to withhold that information. You know, so at best, this is utter incompetence on behalf of the minister and his staff in terms of communicating with Albertans. And at worst, this is a step by this government to save money on the backs of Albertans that are simply trying to protect their health and live their lives. Either way, it's unconscionable and it's unacceptable. The government needs to pause this program until they can sit down and do this work properly with respect for these Albertans.
All right, and seeing no more questions today, that will conclude our press conference. Thank you all for coming today.
Thank you.
Much for watching, and to learn more, check out albertasfuture.ca.